Gaining buzz on social media for shining a light on the silent struggle that many people face.
It's commonly used to describe someone who is suffering internally, but is still able to excel in their career and social life, proving you never really know what someone is going through. Joining us now is licensed clinical social worker Kelly Kitley. Kelly, we're so glad to have you here on this topic because it's an important one and there's so many layers to it. Let's just kind of start big picture here. It really does, in a lot of ways, seem to be the opposite of what people expect depression to be. Those moments when people can't get out of their bed, they can't hold a job, they're crying all the time. Talk to us about the differences and what are some of the symptoms of this other type of high functioning depression.
Sure. So thank you so much for covering this. This is important to talk about because it is an internal struggle for a lot of people. And oftentimes we look at somebody on the outside and may assume that they're doing okay on the inside. And with high functioning depression, that's actually the exact opposite. And so somebody may be excelling in their career, in their personal life, in their relationships, but they may be experiencing negative self-talk and self-criticism and just not feeling good enough. And it is a silent killer oftentimes for people because they're embarrassed. How could I feel depressed if I have such a full life?
You know, Dr. Kitley, that leads us to this next point. The mother of former Miss USA, Cheslie Kryst, she released a statement to NBC News shortly after her death by suicide in 2022. And she said, quote, she was dealing with high-functioning depression, which she hid from everyone, including me, her closest confidant. This is her mother. So how do you help someone in your family or a loved one if from the outside you can't even tell that they're struggling?
We need to get better at asking people how they are really doing and get better at listening to the answer as well. Check on your mom friends, check on your high performing professional friends. You know, serendipitously, I did read this book that was co-authored by Cheslie and her mom, April, called By the Time You Read This. And it was so shocking that this wasn't, we can be so close to people, but we have to destigmatize and remove the shame so that we can get more vulnerable, especially with the people that we're closest to.
You know, a lot of people probably would say, yeah, I suffer with occasional sadness and sometimes I'm really, really sad, but what do you mean by debilitating? What does that look like and how should someone seek help if they are in this space where they feel like they're high functioning, but they're also really struggling?
Yeah.
Sure. So it is important to recognize that emotions are along a spectrum. And so it is normal to have low days and high days and in between days. But if there are symptoms that are persistent for 2 weeks every day, then it is really important to seek professional help. And you can get a referral from a doctor or a friend. Oftentimes people wait until they are really in the trenches to ask for help. And I encourage people to be proactive. Don't wait until you're not sleeping or you're losing weight or you're having feelings of hopelessness. If you start recognizing that you're having persistent thoughts that are critical and maybe feeling like you're not good enough, then do check in with somebody and try to rewire some of those core beliefs.
So important to be proactive. Licensed clinical social worker Kelly Kitley outlining the many ways help is available. Kelly, thank you so much. And if you or someone you know is struggling, you can call 988 to reach the National Suicide and Crisis Lifeline.